It seems that at some point recently, it was decided that walking forward, something we have absolutely mastered as a species, was no longer enough. Now we're walking backwards, on purpose, in public, making intense eye contact with anyone who dares to question us. Retro walking is the topic of this week's Healthcare Triage. Okay, we're exaggerating a little for fun, but the concept of retro walking for health reasons has actually existed for hundreds of years and basically is exactly what it sounds like. You walk in reverse instead of forward. That's it. No subscription required. But the real question is whether it does anything useful or whether it's just another wellness trend taken TikTok by storm before being replaced by, I don't know, aggressive sideways crawling. First, there are some real biomechanical differences between forward and backward walking. When you walk backward, you tend to put less stress on joints like the knees because the loading patterns are different. Walking backward activates muscles a bit differently and might increase energy expenditure slightly compared to forward walking at the same speed. It might also make your balance systems work harder because, well, you can't see where you're going. Some studies suggest that might improve balance, coordination, and even proprioception, which is your body's sense of where it is in space. So it's plausible that walking backward makes your brain and body work a little harder than your usual autopilot stroll while thinking about snacks or replaying arguments in your head. And according to some studies, it's plausible that it has a positive effect on things like low back pain and general rehabilitation when used as part of a broader exercise program. Fortunately for us, and this episode, we can look further than the plausible evidence because someone has actually conducted a randomized controlled trial on walking backwards. What a time to be alive! In that study, participants who added retro walking to their routine, specifically people with knee osteoarthritis, saw improvements in pain, functional ability, and in some cases, range of motion compared to participants in the control group. That's impressive, but there are caveats. Are there ever not caveats? While this counts as decent evidence that retro walking is helpful as a therapeutic exercise for certain conditions, it does not mean that you, a generally healthy person, will unlock secret bonus health powers if you start regularly moonwalking down your street. So what actually matters in real life? If you have a condition like knee osteoarthritis or you're in a rehab setting, retro walking might be a helpful tool. It might reduce pain, improve function, and add variety to exercise in a way that's supported by at least some clinical evidence. If you're otherwise healthy, it's probably fine to try if you enjoy it, or if you do it safely, like on a treadmill with supervision, or in a clear space where you won't immediately trip over a curb and end your fitness journey on the spot. Might challenge your balance and muscles in a slightly different way. But it's not magic. It's not replacing regular walking, strength training, or any of the boring, well-proven things we already know are good for you. So if you see someone confidently striding backward at the park, just know that they might be doing something mildly beneficial for their joints, or they might just be committed to the bit. And honestly, we're here to support them either way. Hey, you enjoyed this episode? You might enjoy this previous episode on Do You Really Need 10,000 Steps a Day? We'd appreciate it if you'd like today's video, subscribe to the channel down below, maybe go to patreon.com/healthcaretriage, support the show, make it bigger and better. We'd especially like to thank our research associates, Edward Liljeholm and Christopher Learn, and of course, our Surgeon Admiral, Sam.